And you can't really know from person to person. That's why I said if you look at a anatomical drawing, it will be a very idealized version of what the small intestine looks like. First of all, there can be a kind of a prolapse, which can involve just the small intestine, where basically the small intestine doesn't have enough um, muscle tone or strength in its peristalsis to maintain its shape. So what can happen is that it kind of falls down and collects in the bottom. And when that happens, you will be able to feel, if you're pressing in here, you'll be able to feel a mass down here and an empty feeling up here. So, um, generally speaking, I'll start here on the patient's left side, so where the descending colon is, and I'll start to see with my hands if I can start to kind of push the small intestine and see if I can spread it up so that it distributes um, more evenly throughout the abdomen. Because if you can spread these things out, it will make it easier for food to pass through there. Like I said, it's common with women who have had a lot of kids for some level of prolapse to be happening. Um, so the first thing I would try to do would be to start, first of all, see if it feels empty at the top and full at the bottom. And if it does, see with gentle vibration if you can kind of help to lift things and distribute them more easily. One thing that can happen is, besides the small intestine prolapsing and kind of falling towards the bottom, the large intestine can also prolapse towards the bottom. And so that gives another couple of areas where there could be a problem. Sometimes there's a problem over here at the curve, and sometimes there's a problem over here. And if this whole thing loses muscle tone, you can get a situation where it twists on itself like that. And then whatever food is trying to get through there can't make it through this bend. And this is something that I've seen on a lot of people and worked on with a lot of people.